Hello, I'm Dr. Stephen Blomerth, and welcome to Natural Health Today. This is a show that's designed to talk about your health concerns, the questions that you might have about yourself, a friend, a family member. And what we do on our show is answer viewer questions, and we talk about natural health ways to help a person. And when I think of natural health, I think of basically four main avenues. The first avenue I think of when it comes to natural health is manipulative care, or moving joints that are stuck by hand, manipulation. What that does is free up nerve flow in the area. Also, it restores motion to any area. It could be the hand, the foot, the shoulder, the spine, but anywhere there's a stuck joint and a lack of mobility, it causes all kinds of reflex changes. Might be pain in the area, might be dysfunction in another area. So manipulation is a nice non-invasive technique to help you feel better and get better and be able to do normal things. The next aspect that I think of as natural health care is muscle work. And I'm not talking about a simple massage, but I'm talking about what we call fascial manipulation or trigger point therapy, in which we find spots in your body where knots have formed. You may or may not be aware of where these knots are. They're not necessarily tender until you touch those areas, but almost all of them will feel stiff, and when you press on them, they'll give you inordinate amount of pain. These trigger points can, for instance, there's a site in your upper trapezius that can give you trigger point pain up above your head, and most people say, well, that's just a headache. Well, it may be stemming from here. Same thing as a spot in the back of your shoulder that can hurt all the way down into your wrist. So muscle trigger point therapy is an important part of people getting better. The third aspect of natural health care is exercise. And when I talk about exercise, I'm not talking about going to the gym or standard stretching exercises, because I've been in practice for 38 years, and I've seen people who've gone to the gym 7 days a week come down with a problem. And so I always ask them, well, if your exercise regime was so good, how come you've ended up at my office? So I'm talking about specialized exercises, not to necessarily make a person have huge biceps, but I'm talking about the type of exercises that make you stable so that you have a good combination of strength and flexibility. These stabilization exercises, best one I've seen in 38 years of practice, I've learned from a group called foundationtraining.com, and you can find them on the internet as well. They have some introductory exercises that they give away on YouTube, and foundationtraining.com videos are a great place for you to start to learn to help yourself get better. And the fourth avenue of natural health care I see is nutrition, because a person can't be healthy long-term unless they have a good diet. And I'm not talking about people taking vitamin supplements. I'm talking about just day-to-day eating. Now, some people need to take nutritional supplements because some people just don't eat enough of the right foods. But I'm talking about a combination of eating right to keep your weight within normal limits. And to me, a normal limit is not having any belly fat. No healthy person should have belly fat. And when you put all those four aspects together, that's what I call natural health care. And fully 80 to 90% of day-to-day, the common run-of-the-mill things that people go to the medical doctor for, to ask for a drug or some type of surgical intervention, they can be helped by a combination of those four avenues of natural health care. Most people who have day-to-day health care problems would benefit not from taking a pill, but from learning what's causing the pain that they're trying to make go away or disguise by taking a pill. So we invite you to participate in the show, and you can send in your questions to participate in the show several different ways. One is to send your questions via email to pbdchiropractic@gmail.com. Or you can simply telephone my office with your question. My office phone number is 978-535-6155. You can even send an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. But whichever way you choose to participate in the show, we'll slightly disguise your name, and we'll talk about natural health means that'll help answer your question. Or if there's no answer to your question that's available via natural health, we'll try to point you in the right direction. The main idea for everybody is to get better. If you can get it better via natural health care, so much the better. If you need surgical or drug intervention for those minority people, that's a good option, but it's nice to know your options. So I'm going to put on my reading glasses. We'll look at some of the questions that have come in since our last episode. And Mark writes in from West PBD, says, I got back pain last week after playing tennis, but it seems like my back has been bothering me for a little while now. So I think the pain was going to come on anyway. Well, what really did it was I changed my serve, so I was throwing the ball higher and reaching up more. I probably ended up arching my back more to go after the ball. Do you think I have arthritis or what? Well, Mark, it's quite a leap from seeing your back pain and whether it's arthritis or not. So let's talk about the possible causes of why a person can have back pain. And I'm talking about the simplest everyday causes. Well, one of the causes can be that you've activated certain muscles in your back over and over again so that they've developed too much strength on one side and too much laxity on the other side. It'd be like if you had a tent, and if you had two sides of the tent, you'd want one side and the other side to pull equally strongly, but that doesn't occur in sports like tennis, where we tend to do one thing over and over again. For instance, I'm right-handed, so I serve overhanded with my right hand. My left hand isn't doing the same thing. So we're going to develop a certain muscle imbalance, and that's just the nature of the beast. It's a rare person that can be a right-handed person and be taught to serve overhanded with his left hand. But what we can do is do some exercises that make us as stable as possible. I've heard some people say, well, tennis, that's great exercise. I'm a tennis player myself. I don't consider it exercise. I consider it a sport, and I do exercises so I can continue to play the sport that I like. But I don't consider tennis to be an end for what I'm going to do for exercise. I consider it a fun thing that I do as a reward, and in order to keep on being able to enjoy my reward, I exercise so that I can have relatively, as much as possible, even balance between my right and left side of the body, front and back. And the type of exercises to do that are the foundation training exercises I talked about just a couple minutes ago. And then Mark went on to say, do you think I have arthritis? Well, Mark, if you live to be old enough, everybody has arthritis to some degree. How do you tell if you have arthritis? Well, probably the cheapest way is to take an x-ray. What does arthritis look like on x-ray? Well, if you thought of each of my hands as being a bone, they're supposed to be a certain distance. So let's say this is the normal distance between the two bones. When a joint gets arthritic, the bones get closer together. They don't necessarily have to even be touching. They just get closer together. When two bones sit more closely together, they don't have the same pliability, they don't have the same flexibility, they don't have the same ability to move in all the different directions. Well, many people have been told by their medical doctor, well, you have arthritis, there's nothing that can be done. And there's this much truth in that statement. If you take an x-ray of a person's spine or any joint, and you see that they have less space in between the two joints, you can never change the way that x-ray looks to make it go back to before that person had that loss of space between the joints. So that is correct. You can't change how the x-ray looks. But most people don't care how their x-ray looks. What they care about is, do they have pain? Can they play a sport that they like? Can they do an activity that they like? Can they be functional? And people who have arthritic changes in any area of their body, if they receive that chiropractic or that natural health care that I was talking about beforehand, in other words, good joint manipulation to free the joints up as much as humanly possible, muscle trigger point work to eliminate the types of problems that we can have in our body when a particular muscle group is too tight or has trigger points in it, when we get exercise to make us more stable, and when we eat a good non-inflammatory diet. People who have quote-unquote arthritis feel so much better that it doesn't make any difference how their x-rays look to them. They're able to participate and do the things that they like to do. So Mark had, back pain. He says it was from serving in a certain way. It's likely, Mark, that you could have several things wrong with you that only came out because you changed your serve. Was it the serve itself, the reaching higher, arching his back more? Well, if Mark was stable, he should be able to slightly alter his serve. But if you're unstable due to any reason, changing your serve and then participating in a sport or changing anything about your sport that you've done a long time can serve to bring out pain. So Mark, do I know whether you have arthritis or not? I don't. Can you find out from an x-ray? Yes. Will your medical doctor say there's nothing that can be done about it? Pretty likely. Can anything be done to change how their x-ray looks? No. But can a lot be done to make you more functional and have less pain? Yes, definitely yes. And are there any other better solutions? No. There aren't any other better solutions than what I've just mentioned. Can you take steroids and drugs and anti-inflammatories? Yes, you can. Will that change how the x-ray looks? No, it won't change the x-ray looks, how the x-ray looks either. Will it result in a restoration of your normal function? No, it won't. It'll just cause you to have less pain for a short while that drug is in your system. As soon as the drug is gone, you'll have just as much pain and dysfunction as you did before. That's why natural health care that restores as much as humanly possible the function is the way to go, because people feel better and they're able to do the activities that they like to do in their life. So, Mark, thanks for that question. Let's go on to our next question. Okay, Arlene writes in from Danvers. She says, my primary care doctor put me on a medium dose of steroids and anti-inflammatories, and I've been feeling great ever since. Why doesn't everybody who has arthritis take these? I just notice I look a little puffy in the face. That's probably because I don't walk as much in the winter. Well, Arlene, you kind of hit it right on the head. Not so much the non-steroidal anti-inflammatories, but the steroids do have a secondary effect. They affect your liver. And if you take enough of them over time, you will have a puffy look in your face. Because steroids actually work not just on the area that they want them. So for instance, if Arlene had, say, arthritic changes in her neck. Well, when she takes the steroids, it not only goes to her neck, it goes to her entire body. Every inch of her body gets affected. And unfortunately, one of the central organs that takes a hit is your liver. And having a short course of steroids is not necessarily a bad thing. It can be helpful to get over certain diseases. But taking them long term, yes, it'll make you look puffy. But if looks was the entire problem, it'd be not much of a problem at all. It's your liver function. So steroids can't be taken for a long period of time. Our body makes steroids. It just doesn't make enough for all people, for all circumstances. But when you take a steroid, it interferes with the normal production of your endogenous or in the body steroids called cortisol, and it sets up a bad situation, and it tends to push people towards having diabetes because it raises your blood sugar, much as cortisol does. So Arlene, are steroids and anti-inflammatories the answer to arthritis? No, but for many people who take them, for the first couple months, it can seem wonderful. Are they changing you? Are they bringing about a restoration of how you were before? They're not. They're not changing you back to how you were before. You may feel wonderful, but you are paying a price long term because you're not really restoring the normal function of how the joints move, how the muscles work, how your muscle balance works. And it throws off your entire endocrine system to take those kinds of things. So take them only on rare occasions if need be. It's not the answer to anybody's arthritis. Okay, Dave writes in from Danvers. He says, I used to like to run, but a year ago my medical doctor told me I should stop running so that I don't get arthritis in my knees. Is there something else that I could do that wouldn't be boring, like taking aerobic exercises? I definitely don't want to take one of those women's aerobic classes. Okay. All right. Dave doesn't want to take one of these women's aerobic exercise classes. Maybe he doesn't have the yoga pants for it. His medical doctor told him not to run because it'll give him arthritis in the knees. Well, it's just not true. A study came out just about a month ago saying that people who run have no greater incidence of arthritis in their knees than anybody else. In fact, they have about a 3% less likelihood of having arthritic changes in their knees than a person of the same age. So let me say that again. You are less likely to have arthritis in your knees from running than, say, if you had twins. One twin, so they're exactly the same. One twin is a runner, the other twin isn't a runner. The fellow who's the runner has about a 3% lesser chance of developing arthritis in his knee than the other fellow. So is it the running that makes you have arthritis in your knees? No. We can get arthritis in our knees from a variety of causes. It's wear and tear, many different reasons. But people who run don't come down with arthritis in their knees any more often than people who don't run. So running can be a good exercise. It's not for everybody. There are people who won't benefit from running. But if you have been able to run and it's not hurting you, then giving up on running is not going to be helpful. You won't be any better off by stopping than you will be by continuing to run, as long as the running isn't hurting your knees. Now, can running hurt your knees? It can. People who run with bad foot gear, people who have flat feet, people who have muscle imbalances, they can get pain in their knees when they run. If you can address those problems, and they can be addressed. If you have a flat foot, I've seen, I had a patient once who was discharged from the Army because his feet were so flat he couldn't do the amount of running that the Army demanded that he do on a yearly basis to continue to be certified to be physically fit to be in the Army. And he got a medical discharge from the Army. Well, I made him some orthotics, which is a special device taking him from impression of his foot, put him in there, and he was able to resume running even though he'd been discharged. Why? They didn't look at his feet. They said, oh, you got pain in your knees. Okay, you're discharged. They didn't take the time to have a thought that maybe your feet have an influence on your knees. Well, your feet have an influence not only on your knees, your feet have an influence on your hips, on your low back, mid back, all the way up to the jaw. I had a patient in younger years who had pain in her jaw joint, fixed it by making an orthotic for the person's foot. I'm not saying that every pain in the jaw is due to the foot, but that's an example of how the chain, the biokinetic chain that we are from our feet all the way up to our head, is like a building. The feet are the foundation. If you have a problem, the foundation of a building, where does the symptom, where does the problem show up? It may show up in the basement, like foot pain, or it may show up anywhere along that chain. So that's an example of a person who has a pain, not diagnosed properly, not treated properly, because my idea about diagnosis and treatment is try the simplest things first, try the things that are least invasive, do the least harm, and see how the person responds. How should a person respond? A person should, if a person has an orthotic made for their foot and their pain goes away within a few weeks or less, that's a great result. So that means that you were on the right track. If the person has no improvement at all, well, you haven't made them any worse. It's not like a surgery, which you have a surgery, you go in and you have a procedure done. Are you better afterwards? You might be. Could you be worse? Many times you might be worse. So at least the types of things that we do are non-invasive. They work quickly, or they reveal that that was not the problem. But at least when it reveals it's not the problem, you haven't harmed the person by the procedure that you put them through. Okay. So in terms of running, let's go back, just finish up with Dave. Continue with your running as long as it's not hurting your knees. There's no evidence that suggests that running is going to make you come down with arthritis prematurely in your knees. Okay, Dave, thanks for that. Let's go on to our next one. The next question comes from Nancy. Nancy is from Danvers. She writes in, she says, I have heard you say on your show that good nutrition is one of the most powerful things you can do long-term for your health. But I like what I eat right now, and I don't want to change anything. But what's the one best vitamin I can take? I really want to make things simple. Well, if a person is totally satisfied with their current eating habits, and I think, to be fair, if you're being satisfied means you're at a good weight. Well, let me take that back. It isn't what you weigh. It's whether you have a belly. Because people can look at all kinds of dietary charts. They can look up their height. If they're 5'3", they'll say, well, I should weigh this much or I should weigh that much. That has a small degree of significance. Probably the best degree of significance is, do you have a belly that hangs over your belt? If you do, I don't care what your weight is, you shouldn't have that. So being satisfied with how you eat means that you're not diabetic, you're not taking any of the drugs like metformin or glyburide, and you're not overweight. And again, it's not so much the weight, it's whether you have belly fat. So you shouldn't have belly fat. You should be able to sleep well. You should have the energy that you need. All those things are signs that your diet is good. So what is the one vitamin that you could probably take to make sure that you're going to stay healthy? Well, I'd say in the Northeast here, it would probably be vitamin D3 with K2. Now, it's actually two vitamins together, but D3 or vitamin D is best off taken with K2. What is K2? Well, there is a vitamin called vitamin K, and the K2 prevents the calcium that we need in our body from getting deposited in our arteries rather than in our bones. As you may know, one of the things that vitamin D does is help us absorb calcium and put it in our bones, but sometimes our body can get sloppy if it doesn't have enough K2, and some of that calcium can get placed in our arteries. We don't want that. We want it in our bones. So taking D3 with K2. Why would I say the Northeast? Because we are at a certain latitude where the sun isn't high enough for a good deal of the year for us to manufacture vitamin D3 in our skin. From about Memorial Day, from Labor Day to Memorial Day, so from the end of the summer till about Memorial Day, our sun just isn't high enough in the sky. During the winter, if you ran around naked all day in the winter months, and the sun was hitting your skin without any sunblock or without any clothes on, you still wouldn't make sufficient levels of vitamin D3 to help you. So if you had to only take one vitamin, make it vitamin D3. It also is important for your immune system and maintaining muscle mass. How much should you take? At least 2,000 international units a day in order to see those beneficial effects. So we've come down to the end of our time. I want to thank you for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth. I want to invite you to participate in our show. Send in your questions. We'll talk about natural health means to help you. And there's 3 ways you can send in your questions. One is to pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155, or you can send me an old-fashioned snail mail handwritten letter to 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you participate in the show, we'll be glad to read your question, disguise your name a little bit, and talk about some natural health ways to help you help yourself. So thanks for watching. Bye-bye.